Alright, scenario time. It's 3 a.m. and you're working in Charlottetown when outside the factory you find a 24-year-old male unresponsive. You do your assessment, you get your vitals, and you're wondering if this might be a drug overdose. The patient demographic is right, and you do notice some track marks. Something about this patient is just making you think that it might be drugs. So how do you treat her? How do you know which drug she's taken? The nice thing about pharmacology is that it's fairly predictable. Drugs of certain classes will all behave the same way, and they'll give us similar signs and symptoms. Toxidromes are just categories of these symptoms that allow us to quickly guess which medications someone might have taken and then quickly treat them. There's 5 toxidromes, and now obviously not every drug is going to fall perfectly into one of these categories. They mostly cover the recreational drugs. A few prescription drugs will fit in, but not all of them. But this is just a nice place for us to start. So make sure you use this tool in the appropriate context. So the toxidromes are anticholinergic, cholinergics, opioid, sympathomimetics, and sedative hypnotics. When we classify these, we're going to look at 5 different physical signs and try and differentiate which of the drugs our patients may have taken. We're going to look at heart rate, blood pressure, respiratory rate, temperature, pupil size, and bowel sounds. Each toxidrome has a different combination of these vitals, so it makes classification pretty quick. Anticholinergics would be like Benadryl or Gravol, but they can also have some antipsychotic medications, things like Haldol. There's a fun saying for these patients: mad as a hatter, blind as a bat, dry as a desert. These patients will be dry and agitated, typically tachycardic with high temperatures and really big pupils. Treatment for these guys is going to be fluids for the dehydration and likely some type of a sedative to try and calm them down. Supportive care. Cholinergics are the opposite. These are the wet patients. We'll use the acronym SLUDGE: salivation, lacrimation, urination, defecation, GI distress, and emesis. Basically, these guys are wet and gross. You shouldn't have any real heart rate, respiratory rate, or temperature changes, but they will have small pupils and they'll be leaking everywhere. Examples of where you'll see cholinergics will be in places like pesticides or fertilizers, like on farms. Treatment, again, is supportive care. Opioids are the easy one. The media has made everyone really aware of these, and you'll likely come across an opioid overdose pretty frequently in your career. Opioids are CNS depressants, so slow heart rate, respiratory rate, bowel sounds, low temperature, and those classic pinpoint pupils. Treatment's going to be Narcan, which is a competitive neural blocker. It sits in the receptor site and doesn't let the narcotics work. Sympathomimetics, otherwise called stimulants, are like the opposite of opioids. Everything's jacked up to 10. High heart rate, high blood pressure, high respiratory rate, temps up, and your gut sounds are pretty crazy. You're also going to get some big dilated pupils. One of the things we have to watch for in patients who take sympathomimetics is the development of what's called serotonin syndrome. This is when serotonin levels skyrocket in the body, causing extreme sympathetic symptoms like tachycardia. Treatment here again is supportive: fluid resus, likely some type of beta blocker to keep that heart rate lower, and a sedative to keep them calm. Lastly, we have sedative hypnotics. These are things like high doses of alcohol, benzodiazepines, sleeping pills, and ketamine. Honestly, there's a lot of different types of these. They're really similar to opioids, but don't get these mixed up. Narcan's not going to work on the Ativan overdose. The key difference here is the pupils should stay a normal size in a patient who's taken a sedative. So again, treatment's going to be supportive. You may see a drug called flumazenil given for your benzodiazepine overdoses, but for the most part, it's just ventilatory support and you're just going to let them sleep it off.